Story 1. I work in medical imaging and see many cases like these. I care for vascular patients and people with wounds. One patient had his ankle completely broken sideways. His foot was still wrapped from his hospital discharge. He used the residual limb to move himself in his wheelchair, leaving small bloody sponge marks on the floor. Another patient with severe ankle and foot wounds stopped attending wound care and was afraid to remove the dressings even after the foot developed an odor. By the time I saw him, the skin had partially liquefied. Earlier in my career, I saw a patient with necrotizing wounds to both legs that had progressed to the muscle in multiple places below the knee. He said the wounds had been like that for about 2 years. The next time I saw him, he had undergone bilateral above-knee amputations. I see many stump wounds. Take care of your feet. If you have diabetes and cannot feel bumps and scrapes, please check your feet regularly. Story 2. I am a former medic. I was called to a patient who had cut his leg while chopping wood about a week earlier. It had become very itchy. He was an elderly man who did not drive and lived alone. I unwrapped his severely swollen leg and discovered he had tried to close the wound with superglue. Maggots had begun to grow inside. The itching he felt was caused by the maggots moving under his skin. Story 3. A man came to the emergency room with a necrotic leg. An angiogram was attempted to restore blood flow, but it was too late. He had multiple clots in his lungs and legs and undiagnosed atrial fibrillation. He could not believe an amputation was necessary and kept asking what else could be done. He reported that the limb became discolored about a week before he sought care. Story 4. I am a doctor. We saw a 65-year-old man who had been diagnosed with lymphoma 8 months earlier. He lived an hour outside the city and did not want to drive in for treatment, so he chose not to receive therapy and remained alone at his remote home in the country. Because he did not receive treatment, the disease spread over his skin, and his neighbors called an ambulance when they checked on him. It had spread from his head to his knees and had begun to involve his eyes and oral mucosa. He could not drink and could barely see. His skin had begun to slough off, and he was so severely dehydrated from fluid loss through his open skin that we treated him as a severe burn patient and involved the plastic surgery team. The consultant said that if he had received treatment earlier, there might have been a chance of recovery. He died 3 weeks later. Story 5. This happens all the time. People have a large stroke at home and cannot move an entire side of their body. They wait several days thinking it is the flu or something. It is not the flu. A large clot in the brain may be the cause, and the damage could have been reversed if they had sought medical care immediately. Story 6. Years ago, as a nursing assistant on an oncology floor, we admitted a man who had an erection for several days and had lost the ability to urinate. His bladder was nearly bursting and his genitals were severely damaged, like an overcooked hot dog. But none of that was as striking as the untreated skin cancer on his nose. Over several years it became infected, developed methicillin-resistant Staphylococcus aureus, and spread across his face. He had lost his nose, cheek, and one eye, and was beginning to lose the other. You could see part of his skull. I do not know why he left it untreated or how long it took to get that bad, but I will never forget the smell and texture of his rotting face. On the upside, we persuaded him to have reconstructive surgery. He received a skin graft that covered his eye, nose, and cheek. If you ever meet a very grumpy man with only a mouth and one eye, know this is far better than the alternative. Story 7. This has happened a few times. A woman came in on Monday after being discharged from the hospital on Friday after giving birth. We advise women to avoid intercourse until a doctor clears them. Her partner insisted, and on Friday night she allowed him to have intercourse. He tore some surgical stitches and she bled heavily all weekend. She came to our clinic with blue lips and fingers, and her hemoglobin was 4. Normal hemoglobin is 12 to 15. She did not want to be a bother, so she waited until she was constantly dizzy. She returned to the hospital for a blood transfusion and stitch repair. This is not the first time I have seen this. If a partner pressures you for sex after childbirth, he needs to practice self-control and consider using lubrication instead of resuming intercourse too soon. Story 8. An older woman called requesting a prescription for pain medication because she was sure she had shingles. She said her neighbor had shingles and she believed she had the same. She had not had an exam in almost 2 years, so the physician asked her to come in for an evaluation before prescribing medication. She refused and called again the next day, repeating the request. This continued throughout the week until she finally agreed to an appointment. It was not shingles. It was a skin ulceration caused by advanced breast cancer. Story 9. I have seen a few cases over the years. They generally fall into 2 categories. If it is not diagnosed, then I cannot have it. And I did not think it was that bad. As a medical student, I remember an older woman whose breast had become necrotic and was falling off. It had been progressing over several years, but because she had not been diagnosed with breast cancer, she believed she could not have it. In the other category, I treated cases of Fournier's gangrene, typically in obese men with diabetes who developed a small sore in the pubic area. By the time they reached the hospital, the infection was severe and treatment often required removing infected tissue in the pubic and groin region down to the muscle. That little sore did not seem like much at first. Story 10. I am not a doctor or hospital staff, but my grandfather died because he waited too long to go to the hospital. This was about 17 years ago. He was tending one of his mules when something spooked it and he was kicked in the abdomen. He was in a lot of pain and could barely move, so he decided to take it easy and lounge on the couch for a week. He refused to go to the hospital. Unfortunately, that mule kick ruptured an undiagnosed tumor in his intestines. The doctor said it was very large, about the size of a volleyball, and he might have survived if he had come in sooner. By the time we got him to the hospital, he had a severe case of gangrene. His leg needed to be amputated within a day of his admission, and he died a week later. Story 11. A patient presented to the emergency department with abdominal pain, and clinicians discovered a fungating breast wound that she had had for 2 years and had not sought medical attention for. A biopsy and positron emission tomography scan later, she was diagnosed with breast cancer with extensive liver, lung, and bone metastases. This occurred in Australia, so it was not a financial access issue. It was very sad. Story 12. I am a doctor. While working in accident and emergency, we saw an older man, possibly in his 70s, who several days before presentation had sudden severe chest pain and vomiting while loading shopping into his car. He ignored it and struggled home. The next day he began to lose the use of both legs, and by the time he came to hospital he had been crawling around his house for several days because he thought it would get better. He had a major cardiac event and developed an embolus that the heart pumped out. It traveled downward, fragmented, and occluded the arterial supply to both legs, causing extensive bilateral limb ischemia and non-viable tissue. I do not know the final outcome. The limbs were not salvageable, and I believed the prognosis was poor, possibly fatal. Edit, because there is a lot of United States assumption, this occurred in the United Kingdom, where healthcare is free at the point of access, so debt is not a contributing concern for our patients. Story 13. I am a children's nurse. In my first week in the pediatric emergency department, we saw a 6 or 7-year-old girl with a severely swollen jaw and face. She could not move her jaw without intense pain and had been unable to eat for several days. She had only just started brushing her teeth for the first time and developed several dental abscesses and severe tooth decay. Her mother said the girl was recovering from procedures to remove most of her teeth for a similar reason. They had not wanted to see a general practitioner because they thought she was avoiding school. Story 14. A patient was brought in by her son, who said he took care of her. On arrival to our unit, I performed a skin assessment. When I removed her socks, I found a gangrenous toe that had fallen off. It seemed unreal. I wish this were not true, but it was by far the worst thing I have witnessed. The son said he had no idea when his mother's foot became that bad. Story 15. An elderly woman fell at home and broke both femurs. Her son, who lives with her, thought she just needed to rest and carried her to her bed. She lay in her own filth for 3 days before anyone called emergency services. Other family lived next door. How could this happen? Story 16. I am not a doctor, but I have a story about myself. I got very sick very quickly but did not realize how serious it was. I had stage 4 Burkitt leukemia with central nervous system involvement, which is important to know. Fewer than 100 people my age in the United States are diagnosed with that cancer each year, so it is quite uncommon. About a year ago, I became very ill, and I happened to have a doctor's appointment scheduled. I went to the appointment feeling terrible. Sweaty, hot, lethargic, lightheaded, with severe heartburn and shortness of breath. My father, who was driving me, had to wake me. He said, "Get up. We have a doctor's appointment. You better be really sick." He had no idea, and neither did I, how ill I was. 2 weeks earlier I had been fine, working in South Carolina on a construction job. At the appointment I had blood work and an ultrasound of my chest cavity. The doctor was stunned by the ultrasound images and then by my blood work. He told me to get back to the hospital immediately. The doctor saw 7 tumors on my liver, the largest the size of a grapefruit and the second largest the size of a baseball, and my blood work was severely abnormal. He diagnosed me with cancer and said it was a miracle I was awake and walking. I later learned that Burkitt cells can double in size within 24 to 48 hours. The doctor wondered why I had not had problems from the large tumors earlier, since I had only scheduled the appointment for heartburn. In short, I made a doctor's appointment for heartburn and was diagnosed with an aggressive cancer. Story 17. Not a doctor. I was sitting in a hostel with an emergency nurse and an emergency doctor. They had just discovered that, although they worked on different continents, they did similar work. We were happily chatting when an older man walked in. He overheard that they were in the medical field and came over to ask a question. He showed them his leg, which had large black spots all over below the knee. Both the nurse and the doctor looked at it and immediately said he needed to go to the emergency department. They said the leg looked necrotic and that he risked losing the leg or his life. He replied that his doctor back home had told him the same thing, but that the leg felt fine and he would know if it were dying. He said he was not going to ruin his vacation by seeking medical treatment. That left me wondering why he had asked in the first place. He went to sit at the bar, and over the course of the evening both clinicians left the table several times to try to convince him that he might not have 10 days before he returned home, and that he needed to have the leg examined immediately. They were unsuccessful. I am pretty sure that if he made it to a hospital, the staff asked themselves why he had waited. Story 18. When there are maggots, it is a clear sign of serious problems with a person's living conditions. Story 19. I work in orthopedics. A very common occurrence is that a patient is told to follow up within the week. We prefer to see fractures between 5 and 7 days. Often the patient will call on the 6th day and say they broke something and need to be seen the next day. This is frustrating because we rarely have the ability to get a patient in the next day, and if they had called on the day of the injury or the day after, we could have gotten them seen. My number one "why did you not come in sooner" moment was a call from a patient who had broken their forearm 2 months earlier and never followed up. I scheduled them and they did not show for the appointment. After rescheduling, they did not show again. On the second rescheduled appointment, they arrived with a very obvious deformity to their arm due to the fracture healing incorrectly. If they had come in when asked, it would not have been an issue. It is surprising that they went almost 3 months without care. Story 20. My cousin is a pathologist assistant and told me she had to dissect an 11-pound testicle. It turned out to be testicular cancer. Story 21. I am a patient. For 6 months in 2014, I complained to my family doctor that it felt like I had swallowed a super ball that was stuck, and that walking to the mailbox and back caused such labored breathing that I needed a 10-minute break to catch my breath. I was also coughing up blood from time to time. He became annoyed by my complaints and kept prescribing steroids. He told me that because I was overweight and a smoker, I needed to accept that I had chronic obstructive pulmonary disease and that would be my life from then on. I finally asked to be sent for a test that would look that far into my throat, and said that if it came back as nothing, I would stop complaining. 3 weeks later, I had a sonogram and they asked me to stay for another test. Then they became alarmed and said I had to go from the testing facility to the emergency room in an ambulance. Their hospital refused to see me, so they sent me to a different hospital that also refused. We still had no clue what was going on. I was finally taken to my current hospital medical center, and they told me I needed emergency surgery to try to remove the tumor growing inside my airway. I only had 4 millimeters, about the thickness of a coffee stirrer, to breathe through. Had I not made that deal and had accepted that not breathing was my new normal, I would have lived only another week or two. My family got a new family doctor. I was diagnosed with terminal stage 4 cancer in my throat, lungs, and spine in April 2015. I am losing my fight and started home hospice 2 weeks ago. I put up a good fight and I am so thankful that I did not die in 2014. Story 22. A colleague removed a diabetic patient's sock and the toes came off inside it. Story 23. I was working as a surgical junior when my team was called down to the emergency department to see a patient who had come in with a complication from a recent hernia operation. On arrival, the patient was holding a plastic bag over their abdomen. When we removed it, the wound had opened and their intestine was exposed. It turned out this had not happened overnight. It had taken several days. The patient had begun using plastic bags and newspaper to dress the wound after dressings ran out. Addendum. Because this has attracted attention, I must stress that this case was exceptionally uncommon and an example of what can happen when someone does not seek medical attention when it is clearly required. In general, hernia operations are common and very safe. If you have any surgical procedure and you are not certain the wound is healing properly, seek medical attention. Story 24. Not a doctor or nurse, but I worked as a doctor's office assistant. A regular patient who was very sweet but sadly had an ongoing battle with alcoholism was brought in by his roommate and I knew instantly that he would be dead soon. I had seen jaundice patients before, but this man was a yellow I never knew was possible. His roommate said through tears, "I've been telling him to come in for weeks." And the patient kept telling his roommate to relax, that he was fine. He was in denial. I helped him to the exam room and when the doctor entered, the doctor immediately asked me to go call an ambulance. A few weeks earlier would not have helped, but perhaps his final days could have been a bit easier. He died 7 days later in the hospital. It hit me very hard because I had known the man for a few years. Sometimes he would be sober when he called, and sometimes he would be slurring and completely incoherent, but he was always kind. Thank you to everyone for sharing your stories of loved ones who struggled with alcoholism. I have read every comment, and it is sad how many of you know someone with similar stories. Something has to change in the culture around drinking. If you find yourself wondering if someone will be saying these things about you someday, talk to someone, an unbiased friend or a family member. Be honest with your doctor. And if anyone ever tells you they want to quit drinking, be supportive. Story 25. My girlfriend is a care worker. She recently told me she slipped off a slipper belonging to a patient and remarked that she did not know he had lost his toes. The patient replied that he had not known until she took the slipper off and called her dear. It sounds like something from a grim sketch show. God bless anyone who can do jobs like that. Story 26. A story from my sister-in-law who is a nurse. A young man was brought into the emergency room. He had a sinus infection he had ignored until it had eaten through the skull and into his brain. She was told it had started several months earlier. He did not want to see a doctor. All it would have needed was 10 days of oral antibiotics. Instead, he was not brought in until he was unconscious, and he died within a few hours. Story 27. I am an accident and emergency doctor. A farmer in his 70s reluctantly came in with his wife after falling outside while wrangling a sheep 1 week earlier. He did not want to be there but had been forced to come by his wife, who was worried about him. On questioning and examination, he was pale, short of breath, and clearly in pain on the right side of his chest, but trying not to show it. Chest X-ray and blood tests showed that he had fractured multiple ribs, punctured his lung, and bled profusely into his chest cavity, and was now very anemic. Story 28. A patient came in saying he could not see. When I asked how long it had been going on, he said 5 days. He had been blind for 5 days and had not come in because he thought it might be like a cold or something. During the exam, when I asked him to move his legs, he said he could not. I asked how long he had been unable to move his legs or walk. His wife said about 2 years. They had never seen a doctor about it. They had borrowed a friend's wheelchair and kept it moving. It turned out he had suffered multiple strokes and had several unaddressed risk factors. Given how little insight he appeared to have into his condition, I felt sorry for him. He did not have insurance, which likely played a role in his avoiding medical care. Story 29. Not me, but my brother is an emergency medical technician at a warehouse. He recently had a man come to his station saying something was wrong with his toe. He asked the man to remove his shoe, which he did. My brother was about to ask him to remove the bandage around his big toe, before he realized the bandage was actually the man's skin. Apparently, the man had dropped a 20-pound tote on his toe a week earlier and had been showing up for work anyway. They sent him to the doctor, and the doctor sent him to the emergency room. The diagnosis was a tissue infection and osteomyelitis, a bone infection. After returning from the emergency room, the man told my brother that he did not want to be treated by the emergency room doctor and preferred to use his own insurance. My brother explained as best he could that he was already likely to lose his toe and that if he waited any longer he risked losing his entire leg. I do not know what happened after that. I hope he understood. Story 30. I am not a doctor, just a student shadowing. During the coronavirus disease 2019 pandemic, a man with a history of heart problems had a heart attack with classic chest pain. He then developed symptoms of heart failure, which he recognized because it had happened to him before. He delayed seeking care for several days because he was worried about coming to the hospital during the pandemic. Finally, his condition worsened so that he could not breathe due to fluid backing up into his lungs. He went to the emergency room and was hospitalized. My professor said he recently had a patient with an aortic aneurysm who was misdiagnosed after only a telehealth visit without imaging due to the pandemic. She later developed an aortic dissection. She was first seen at an outside hospital and came to our institution for a second opinion. She followed recommended steps, but the outside hospital failed to perform imaging. The coronavirus disease 2019 pandemic is harming people who are ill and those who avoid hospitals and therefore do not receive needed treatment. Story 31. Okay, I am not a doctor. I am the idiot who did not come in sooner. When I was a teenager, I thought Converse were the best, even though the pair I bought were pretty cramped in the toe. I used them all the time for physical education. This is where things started to go wrong. I started getting an ingrown toenail, and instead of taking care of it, I tried to cut the nail out and ended up with a puffy, red, angry, shooting pain in my toe. Then I noticed some wetness in my shoe. It was pus. What did I do? I bought a new pack of socks for the next 2 weeks. In week 2, I woke up and my foot was on fire. Half of it was red, half purple, and very puffy to the touch. I went to the urgent care clinic with my mom. I did not show her the foot. I just said I thought it needed to be looked at. The doctor came in. Yes, I will take a look, but we do not do ingrown toenail extractions here. I am sure it is not that bad. I took off my shoe. The smell was terrible. My mom turned white and had to sit down. She began to pray continuously. The doctor said, "That is the most infected thing I have seen in the last 10 years. I will grab the kit. We need to get this toenail out and put you on serious antibiotics now. Do not mess around with ingrown toenails." Story 32. I am not a nurse or doctor, but a laboratory scientist. A man came in at the end of the day with chest pain that had been bothering him all weekend. The emergency department doctor ordered a troponin blood test, which helps rule in or rule out heart attacks. If the test result is above 0.03, we consider that a sign of a heart attack and act accordingly. His first troponin result was 21.0. The highest we had seen until then was 8.0. The patient should have died long before, but he somehow survived. Do not ignore chest pain. The hospital where I work is a very small 25-bed rural community critical care hospital. It does not have dedicated cardiologists, a catheterization laboratory, point-of-care assays, or an extensive test menu. Basic services only. The patient did survive. Story 33. So many stories here. We can start with a gentleman in his 70s who was diagnosed with diabetes. His doctor instructed him that it is important to wear socks and supportive shoes throughout the day. He interpreted that to mean wearing the same pair of socks continuously and never taking them off. He showered, slept, and wore the same socks for weeks. He came to the emergency room because blood was oozing through his sock and he had pain underneath. When the sock was removed, he had a diabetic ulcer that had opened and was full of maggots. Not a pretty sight. We clarified those instructions quickly. Story 34. My dad is the one who would not go in. He got a sore in the crease on the bottom of his second toe, the one next to the big toe, the piggy that stayed home, and kept ignoring it. He would go with his wife to her nail salon to have his toenails trimmed, and I think that is where the infection entered when they soaked his feet. He ignored it for a couple of weeks until his wife made him see the doctor. It is a good thing she did. The infection had reached the bone, so they had to remove his toe at the first knuckle to stop it before it spread further. The doctor said that if he had waited longer, he could have lost the entire foot. He is lucky to have only a stubby toe and not have lost his leg. Story 35. Emergency room physician assistant here. The worst case I ever saw was a man in his 50s who was an alcoholic with anxiety who was brought in by his neighbors for a facial infection. It turned out he had squamous cell skin cancer that made the left side of his face resemble the Batman villain Two-Face. A computed tomography scan of his face and neck revealed the cancer had spread into his lymph nodes and mandible. The skin on his face was sloughing off as I spoke with him, and the odor was overwhelming. I nearly vomited. He said he had been terrified of doctors and hospitals and was extremely anxious the entire time he was in our emergency department. His neighbors had been trying to get him to the hospital for months, but he refused. We transferred him to a tertiary care hospital with ear, nose, and throat specialists and oncologists. A few days later, his chart indicated his disease was terminal. Story 36. I am a nurse. I work in a very rural hospital, and we have a patient population that seems to avoid the hospital at all costs. I have seen many cases, usually patients with diabetes who had foot sores, almost always resulting in the amputation of a toe or more. My favorite was an elderly farmer who came in with chest pain that would not go away, as he put it. When we asked whether he had experienced it before, he said he had been having chest pain on and off for years, but it would typically go away after he grabbed his electric fence. Apparently the first time he had the pain, he was standing near an electric fence on his farm, reached out to steady himself and accidentally grabbed the fence. The shock made the pain go away. After that, whenever he had the pain, he would grab the fence and it made him feel better. He had been cardioverting himself for years. He was treated and sent on his way. We still chuckle about it because he was so nonchalant. Story 37. I'm still just a nursing student, but my professor told us a story from when he worked as an emergency room nurse. An elderly, 80-something-year-old woman came into the emergency room. While he assessed her, he noticed her oral temperature was normal despite her neck feeling extremely hot to the touch. He took a rectal temperature, which was about 103 degrees Fahrenheit. While doing so, he noticed something protruding from her vagina and removed it. It was an old sock. She said her uterus had prolapsed months earlier and she had been using the sock to hold it in place. They began treating her for toxic shock syndrome immediately, but sadly she developed sepsis and died later that day. Tongue-in-cheek, he told us she died of toxic shock syndrome. Nurses use dark humor to cope. Story 38. I am not a doctor, but I was this patient once. In my sophomore year of college, I started drinking coffee. As a college student, I drank a lot. One evening during midterms week, I got a bad headache, drank some coffee, and settled into work for a few hours. My headache went away, but I started noticing tingling and numbness on the right side of my body. It became bad enough that I could feel a line down my face where the tingling ended. My whole right side was numb. I thought it was just midterms and that I needed to sleep it off. I went to bed, woke up for my 8 a.m. class, and the numbness was worse. Around 10 a.m., I finally asked a friend to drive me to the emergency room. The emergency room doctor was horrified that I had ignored an obvious sign of stroke for at least 12 hours. It was a complex migraine caused by caffeine overdose and sleep deprivation. I adjusted my lifestyle, including monitoring my coffee intake, and have not had a repeat episode. Story 39. Doctor here. This is far more common than you would think. Even in Australia, where healthcare is free, I would see several instances every week. The general public is medically illiterate or willfully ignorant, especially when I worked in rural areas. 1. A woman with a facial basal cell carcinoma, a common and easily treatable skin cancer in early stages, refused to acknowledge it until it had eroded half of her face and caused a severe systemic infection that proved fatal. I could see into the back of her nose from the side. 1. I was held in place only by muscle because the bony eye socket was gone, and she had no cheek on that side. 2. Countless people in their 30s who could not feel either of their feet due to permanent nerve damage from uncontrolled type 1 diabetes. It is a difficult conversation when they ask, "Can you fix them so I can go back to work?" 3. A previously very healthy man in his 60s who rode several long bicycle rides every week, developed chest pain, breathlessness, and near fainting for a few days. He arrived at the emergency department after collapsing with a cold right leg. His cardiac biomarkers were markedly elevated. He went straight to the operating theater for coronary stenting. There was a 100% blockage of the left anterior descending artery, severe cardiogenic shock with poor cardiac output and inadequate oxygen delivery, and because his heart was not pumping properly, a large clot formed in the left ventricle. That clot was shedding small emboli and cutting off blood supply to many organs, including an entire leg. He had ridden 200 kilometers on his bike the previous week. Story 40. A man showed up in my clinic with a complaint of finger swelling. According to the story, his finger became swollen and painful about a week earlier. It got worse, and about 3 days before the visit, a hole opened at the tip of his finger. At that point, I would have gone straight to the office. On the day of the visit, he said he had pulled something out of the hole the day before with a pair of tweezers and had no idea what it was. I asked if he had taken a picture or kept it, and he produced a tissue from his shirt pocket. It was his distal phalanx, the last bone in the finger. The bone had become infected, and the body tried to eject it as a foreign body. He had pulled off his fingertip. I have not seen a better magic trick since. Story 41. Nurse here. I cared for a patient with diabetes who could not afford to fill his oil tank during the winter. He was in his early 40s. He had neuropathy in his feet and could not feel they were becoming frostbitten. He had been wearing his winter boots around the clock for warmth. His sister came to check on him after she realized his phone had been shut off. She brought him in because he seemed confused. The doctor asked me to remove his boots. One of his toes came off with the boot. He required a below-the-knee amputation of one leg and a transmetatarsal amputation of the other, and he was treated with intravenous antibiotics for weeks. This is why we nurses always emphasize, check your feet. Story 42. I am a physician assistant in orthopedics, working in hand surgery. A patient presented who had a wrist replacement several years earlier and reported a hole in his wrist. I initially thought it was a small draining sinus. On review of his radiographs, he appeared to have a large contracture. This was not ideal but not uncommon. He had a Coban cohesive bandage on his wrist. When I removed it, there was a 3 by 6 centimeter wound overlying the wrist prosthesis, directly exposing the polymeric insert that allows the implant components to glide on one another. He said he had noticed the wound about 4 years earlier and only sought care when it became so large that he finally decided to see someone. Story 43. My tooth had been hurting for a couple of months. My face started swelling a few days ago. It became hard to swallow last night, and then I had trouble breathing. A man developed Ludwig's angina. He could not be intubated because of the swelling and required an emergency tracheostomy when he stopped breathing and his oxygen saturation dropped. He received intravenous antibiotics for 2 weeks and was admitted to the hospital for 4 weeks. He easily could have died, all because of a dental infection. See your dentist. I am a dentist and saw this while on call during my hospital residency. To the people concerned about cost, I understand. Dental insurance is not true insurance for many people. It is often a discount program you pay for or a benefit from an employer. In this case, the patient had state medical and dental coverage that covered exams, fillings, and extractions. He still did not come in until it was really bad and did not pay anything for the care he received. During my residency, I treated 90% Medicaid patients. The other 10% were charity cases. I am acutely aware of the problems with cost and access to dental care. Blame the insurance system, not the dentist. If you are looking for cheaper dental care, consider dental schools and federally qualified health centers. Dental schools typically charge about 50% of private practice fees. Federally qualified health centers often use sliding fee scales. In the meantime, do what you can to protect your teeth. Dollar stores sell toothbrushes and toothpaste. Actually use them. A vast majority of dental problems can be prevented with adequate oral hygiene. Cut out soda, avoid energy drinks, and do not live off candy and cookies. Get at least one dental exam per year. Story 44. I am not a doctor, but I am an army medic. A man came to the aid station at about 2 a.m. with his arm completely wrapped. I removed the dressings and the skin looked necrotic. I asked him what had happened. It turned out that the weekend before we went to the field, he had his entire forearm tattooed. He then spent the next week wading through chest-deep swamps, thinking that if he kept his arm wrapped he would be okay. I told him no. Another time, a female lieutenant came in with vaginal pain. I examined her and found a severe infection. She had not changed her tampon for nearly a week. I retrieved it while the doctor observed. Story 45. When I was training to be a nurse, I was paired with a play specialist for a few weeks. A mother came into the accident and emergency department with a boy of about 4 or 5. A doctor asked that we entertain and distract the child while he examined him. He was happy, chatty, and a picture of health from the shoulders up. His belly, however, looked as if he were very pregnant. This surprised both me and the other girl, who had brought the usual toys. We kept small baskets to take where needed. We followed the boy while he underwent many tests. He was extremely brave as the doctors did what they had to. His mother said it had been going on for 3 months. He had a tumor, and the surgeons managed to remove it. But the poor child was embarrassed after surgery because he had loose skin and stretch marks. He often comes to mind, even more so since I had a child of my own. I hope he is doing okay now. Story 46. I had a patient in the emergency room who struggled with alcoholism. She had been having dark stools for some time and had been vomiting blood and clots for a few days. She went into cardiac arrest and had either esophageal varices or a massive dissecting aortic aneurysm. I do not remember which. If she had come in earlier in the week, they probably could have saved her with surgery. It was sad to see her family say goodbye. I also cared for a patient with diabetes who had chronic, crusted leg wounds that had been present for years. The smell may never leave me. She was a very kind woman, and I felt awful for her. Story 47. Dude, these stories are making me want to call my doctor about the dry skin on my side. They are extremely scary. Story 48. A man came in with his pregnant wife in a wheelchair. The baby's head was crowning, and we asked why she had not gone to the maternity ward when she was in labor. He said the waiting room was busy and he would not wait because she was in pain and he thought they were only there to shut her up. She delivered about 20 minutes after she was taken back. And I dread what could have happened if he had refused to wait because of the accident and emergency waiting times. Story 49. I am a pediatric intensive care unit nurse. A known diabetic 15-year-old told her parents she would not go to the hospital for high blood sugars, which were reported as over 300. She did not want to miss her 16th birthday. She became unresponsive on the way to the hospital and developed disseminated intravascular coagulation. When she died, she had received 10 liters of blood products that were not hers. We tried everything we possibly could for 8 hours. Story 50. Wow. I don't know why I'm reading these, but I keep reading them. Story 51. I was an operating room registered nurse on call on a Friday night. I was called in for an exploratory laparotomy. Some late staff had prepared the case and the patient was already in the room when I arrived. I walked in and saw that the patient's testicle was larger than a basketball, with 2 people holding it up to prepare it. A large portion of his intestine had herniated into his left scrotum, and the bowel had ruptured from the pressure. We suctioned fecal material from his abdomen for over an hour. The week before he had lifted something heavy and felt a pop. He had not urinated for 2 days because the swelling had obscured his penis, which is why he finally sought care. Although the scrotal swelling had been growing for a week, he did not survive. He lived through 3 abdominal surgeries, but sepsis from the ruptured bowel was fatal. Story 52. My mother preferred treating her chronic illnesses with herbal supplements she bought on the internet. She had constipation for months and a persistent sore on her abdomen that did not heal despite applying Manuka honey. Eventually, my brother convinced her to see a doctor. They discovered a tumor obstructing her bowel that had eaten through her internal organs and abdominal wall. She lived another 6 weeks. Do not diagnose yourself on the internet. Story 53. I was that patient. When I was 18, I went to the emergency room for chest pain. It was the most painful thing I had ever felt. I felt like the character from the movie Alien. A few hours later, the emergency room doctor released me, saying I had acid reflux and would be fine. Over the next 2 years, this continued. Once a month, it was that predictable, the first Saturday night of every month, I would get this terrible chest pain. No amount of antacid helped, from over-the-counter remedies to prescription medications. I tried not eating that day, drinking milk and sitting straight up all night, but nothing helped. Finally, after I literally passed out from the pain once in front of my mother, she convinced me to see a doctor again. The doctor, the first female physician I had seen, sent me for an ultrasound of my gallbladder on a hunch, and they discovered well over 100 stones. That led to emergency surgery. The surgeon was dumbfounded, and the doctor was amazed I had been passing gallstones regularly for 2 years. Story 54. No acute distress. A few years ago, I had a boil on my butt that I thought, as Mr. Tough Guy, I could walk off. No, you cannot. I was in so much pain I could not sit or stand. I could only limp or lie in an awkward position. I waited more than 2 weeks before it got so bad that I finally went to the emergency room to have it drained. The doctors there were not happy when I told them I had tried to make it go away with Epsom salt baths and wishful thinking. Because of my stubbornness, I developed a staphylococcal infection, and a very upset doctor told me in no uncertain terms that I had brought this upon myself. Story 55. I am not a doctor. My dad felt lousy for about 2 weeks one December. He did not know what was wrong and assumed he had picked up a bug. After a couple of weeks, he started feeling better. Less than a week later, he became very ill again. This time it was severe enough that his girlfriend took him to an urgent care clinic. The staff there told them to get to the emergency room as soon as possible. She took him to the emergency room, they began checking him in, and he died. It turned out he had been leaking stomach acid into his abdomen. Story 56. My dad works as a nurse in the emergency room. A man had been doing mechanical work all night in the middle of winter. He came in complaining that he could not feel his fingers because they had gotten so cold. They were not just pale or purple, they were black. The tissue in his fingers had died and they had to be amputated. Story 57. My favorite story from my time as a psychiatric nurse practitioner. I was called to a suburban emergency room to see a man who said he had a horrible stomach cancer and needed to lose weight to get better. He insisted a very prominent gastroenterologist had diagnosed him with Barrett's stomach, which is not a real condition, since Barrett's affects the esophagus. I was called because the story was bizarre and the staff did not know what to do with him. He eventually disclosed that he had shot himself in the leg a few days earlier and was waiting for gangrene to set in. He believed the resulting amputation would allow him to lose the required amount of weight and thus cure his cancer. I excused myself to tell the emergency room staff they should examine the leg and call the county psychiatric service, which was the hospital protocol. I do not know what happened to him, but that was an impressive manifestation of a delusion. Story 58. My husband, 36, almost died this summer from a dental abscess that became severely infected. Staff in the emergency department asked why he had not sought care sooner. He had visited his doctor 6 times and his dentist 4 times over 6 months, but they could not detect the problem until he presented to the emergency department. They assumed he was the kind of person who does not seek care. Story 59. A patient came in who was blind in one eye. He had waited a week to get to the emergency room. If he had come in when it happened, we could have saved his vision. He was too afraid of the cost and thought it might go away on its own. Story 60. I am an emergency medical technician and have some pretty gnarly stories. One of the worst things I've seen, mostly because of the smell, is gangrene due to uncontrolled diabetes. The call came in as extreme lower limb pain. When we arrived, I examined the wound and saw a man's metatarsal bone exposed with maggots in the wound. He had a long history of diabetes and had not managed it. He eventually had his foot amputated. The smell has stuck with me and probably will forever. Take care of yourself and get help when you need it. Story 61. I am still mad about it. The 3-year-old broke his leg, and his mother brought him to a checkup 3 days later because she was busy. Story 62. I am an emergency medical technician. One day my partner and I were called to a house for a person unable to ambulate. This is a common dispatch. It usually means someone is too weak to get out of a recliner or out of bed. We expected to help the person to their feet and maybe document a refusal or transport them to the hospital based on an assessment. When we arrived, a police officer and a neighbor were there. The neighbor said it was really bad inside. The second I walked through the door, the smell hit me. I have smelled many dead, decaying bodies, and none were this pungent. We walked into the living room and found a man lying on the floor saying he could not get up. His legs were wrapped in what appeared to be plastic wrap and plastic bags. The wrappings were filled and dripping with brown fluid. The man said he had started getting sores on his feet and, rather than go to a doctor, had wrapped them in plastic. I do not know how long he had been doing this, but it had reached a point where he could no longer muster the strength to get up and he was extremely septic. It was horrible. We carried him out of the house. I was at his legs and the gangrenous fluid was dripping onto me. The back of the ambulance smelled awful for days. We transported him to the hospital, and I went outside and vomited. I see many unpleasant things every day, but this was by far the worst. When they removed the wrappings in the emergency department, the nurses told me his legs were completely black and necrotic up to the knees. They had to amputate both legs up to the hips and found the gangrene had extended into his pelvis, so they transferred him for further surgery. I do not know if he survived. If he had gone to a doctor when it started, he might have been diagnosed with diabetes, treated, and lived many more years with both legs. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.